Final Guillain-Barré syndrome video. This graph just shows the course of Guillain-Barré syndrome. The red portion is the time of infection if a virus was the cause of Guillain-Barré, and then the green is just showing the anti-ganglioside antibody activity. The blue one is the actual course of Guillain-Barré, and let me move myself. This part here, this is nadir. So the lowest point of progressive weakness reaches its peak, which is really a valley, before 4 weeks or within 4 weeks, but most commonly it's going to happen within 2 weeks. There can be some chronic symptoms that go on beyond the typical window of the acute stage. So neuropathic pain is normally going to be treated with gabapentin or carbamazepine. Orthostatic hypotension, you're going to see these patients with compression socks, utilization of tilt tables to try to increase their tolerance to vertical, and then ensuring they're adequately hydrated. And then fatigue, we combat that with aerobic exercise, teaching them energy conservation techniques, as well as work simplification strategies. So what do we do in physical therapy for Guillain-Barré syndrome? In the early course of their care, you want to do moderate level intensity activities, including cardiovascular training and strengthening activities. And then as they get further out from their diagnosis, typically closer to that year time frame, you want to focus on high intensity exercise. If they get sore, they may need 24 hours of rest. So you want to monitor for overwork weakness by consistently testing manual muscle tests at each session. They should not be going down, so if they are, we may be overworking them. We do want to focus on fast twitch muscle fibers because those are the ones that have most been affected just by nature of the debility that people experience when they've been in bed, which is a big issue with our patients with Guillain-Barré because they can't move, so they're in bed for a long time. So these fast twitch muscle fiber activities may be fast walking, jumping, quickly changing directions during walking or lunging, and then you also want to focus on eccentric work to mimic more functional movements, so think slow sit-to-stands, something like that. Little clinical pearl, treating patients with Guillain-Barré syndrome will be one of the most exciting things that we get to do in neuro rehab because after nadir, they really start to recover and they can recover quickly. And the individual and the family get really excited about that. So when we get Guillain-Barré syndrome patients, really take the wins as you can because we don't get to see a lot of stuff that's going to get substantially better, right? Most patients will begin to recover at the 28-day mark, and the mean time to full recovery is 200 days in about 80% of cases. Major permanent neurologic deficits can be present in 10 to 15% of cases, so this may be like permanent axonal damage in more distal muscle groups. So I knew an individual who had permanent damage of their dorsiflexors or their, which would be deep fibular nerve, right, going to anterior tib. 9% of them will not be able to walk unaided, but they can walk perhaps with an assisted device, a cane, a walker, something like that. And then 5 to 10% of cases result in death, usually because of substantial infection or because of a pulmonary condition like respiratory failure. More negative prognostic factors are if you are diagnosed over the age of 50, if you had a very rapid onset within 7 days, if you required mechanical ventilation, if you have reduced distal motor amplitudes on nerve conduction velocity studies to 20%, and then if you had preceding diarrheal illness like that C. jejuni or CMV. 80% of patients will have a slow but complete recovery within 6 months, and the survivors of Guillain-Barré syndrome will continue to improve up to 2 years after injury. So the reason I had air quotes around 6 months is because they may have complete recovery, meaning that they're back up on their feet, walking unaided, but they may still have decreased aerobic capacity, decreased muscular endurance, and perhaps some issues with orthostatic hypotension still up through that 2-year point. But overall, this disease process has a very good prognosis when it's medically managed and coupled with physical therapy. If the symptoms progress, like the weakness progresses longer than 8 weeks, it could be indicative of chronic inflammatory demyelinating polyneuropathy, which I'll talk about in a different video, because CIDP is not the same as the acute inflammatory demyelinating polyneuropathy. So I'll address that in a different video.